So considering that each research is new, and particularly the scientific community has agreed on some general principles that must be observed in order to justify the carrying out of this research, uh, of some specific research, I mean. These ethical principles form the basis on which the various ethical rules are based. These principles include, firstly, the autonomy, and there is the description, the beneficence, the non-maleficence, that means avoiding unnecessary harms to others, and justice. This is, in the case of research, the fairness in the distribution of rewards and obligations, and in the process by which this distribution is made, sometimes tested by the willingness to trade places with others one deals with. So, one of the ways to ensure that research complies with these principles is usually, in this case, for example, for autonomy, is the use of the informed consent for the recruitment of potential participants. There are some groups that require special protection, such, for example, children or patients with mental disabilities or prisoners. In these cases, there are particular rules governing the participation of these groups. For this reason, the respect for individuals include at least two fundamental ethical considerations. In the first place, the respect for autonomy, which implies that person capable of deliberating on their decisions are treated with respect for their capacity for self-determination. And secondly, the protection of persons with diminished or impaired autonomy, which implies that the security from harm or abuse should be provided to all dependent or vulnerable persons. So secondly, it is expected that the research will result in some benefits, both to individuals and to society. It should be noted that by benefit, we mean that the research should focus on solving a health problem of a group of patients and not on the benefits that the researchers will gain in particular. In addition, by benefit, it is understood that the design of the research is valid and that the researchers are competent or sufficient competent to conduct the research and to protect the well-being of the research subjects or participants. So thirdly, and complementing the above, it is expected that the investigation will not result in harm to the individuals. However, the risk and benefits of conducting research must be considered and weighted. There are some patients who are more willing to take risks, for example, those with terminal illnesses than others, for example, healthy and young patients. So virtually all therapeutic interventions have some risk. However, in order to justify the research, this research team is expected to show that the benefits outweigh the risk of potential harm. In fourth place is the justice. This involves the fair selection of patients for research. For example, a researcher might be interested in developing a new toothpaste. So he or she recruits children from a public office for this purpose. In this case, the ethical questions to be asked is, if this toothpaste is effective, will it be available to the population from which the study subjects were recruited? So, for example, it could be that the toothpaste will be then marketed at a prohibitive cost for this research population. On the other hand, It is common to find research that focus on only one type of population, for example, children from public schools, with the research clearly identifying the ethical and scientific reasons. I mean, sometimes you can read some research that focus in just one type of patients without a clear justification or reason for doing so. So, fifth and last is truthfulness. That is, that the research must execute and disseminate the results of research as truthfully as possible. This is a particularly critical point at the present, where documents from pharmaceutical companies have appeared to show that many research has been hidden, and companies and researchers have decided to selectively publish only those research with results that support or present some economical advantage for the economic interest of the company. So these are the principles that guide research in humans. We will now examine the ethical requirements that research must meet. These requirements enable the application and evaluation of ethical principles in clinical research to be operationalized, providing a framework for evaluating the ethical justification for medical research involving human subjects. There are 7 requirements. In first place, an investigation must demonstrate that there is a scientific or social value. A frequent problem is, for example, that researchers have proposed to investigate a problem that has been previously investigated, and we actually know the answer of this problem or issue. So the researchers uh, must state very precisely what the new research is expected to add to the medical knowledge. One way to ensure this requirement is through a very precise and completed review of the literature. So in this case, all clinical research should begin where others research has have ended. Secondly, an investigation must have scientific validity. The proposed design must be able to answer the question of the study. For example, there are designs focused on evaluating risks, such as cohort studies, which are sometimes used to evaluate the effectiveness of treatments. And this is wrong. In this case, the design does not allow the question to be answered, which affects all the validity of the scientific of all the validity of any result of this research. On the other hand, the researchers are expected to master the research methods, including also the analysis of the data. Then, the first selection of patients is in line with the principle of justice. In this regard, researchers should specify fair procedures for patient selections that aim to answer the research question and not be limited to the ease of access to a given patient population. It is also necessary to take into account that there are vulnerable people, that is, anyone whose ability to protect their own interest is compromised, such, for example, children or certain social groups, for example, people who are more deprived or less educated, and also hospitalized patients. Although there is no consensus on what is a vulnerable subject, there is an agreement that one should choose, where possible, to select those patients who are less vulnerable. Other sources of vulnerability are those caused by power difference. For example, if the treating dentist or clinician offers a patient to participate in a study, in this case, the patient may feel that if he or she refused to to participate, then his or her dentist or clinician will not be longer be as interested in treating him or her. So another source of vulnerability is belonging to the private group. For example, some people with poor socioeconomic status may choose to participate in the study for some financial reward. But the same person may choose to leave the study if his or her financial situation improves. So, the risk benefit ratio refers to the fact that research should try to obtain the maximum benefit with the least potential harm to the patient in the study. For independent review, this is the ethics committee that decided whether or not an investigation can be conducted based on the background provided by the researchers. The fact that the researcher believes that his or her intervention is not at risk, such, for example, the application of survey, does not mean that he or she can skip the review by an ethics committee. So, likewise, the fact that the patients have given their consent to participate is not enough to consider that our research project complies with the necessary ethical requirements. So, you must present if your research involves human, you must present a protocol to the ethics committee who should granted you permission to carry out the study, and also to obtain the uh, consent of all the people who will participate. So, because the informed consent is one of the requirements, but by itself, it does not ensure that a research is ethical. So, in this case, the informed consent only ensures that adequate information is given to the participating volunteers. It is a mistake to believe that research is ethical just because patients have signed a consent form. And last, the researchers are expected to respect the right of patients to leave the study when they wish and to protect the confidentiality of medical information. In this case, the researchers are also expected to inform participants of any new risk or benefit discovered, as well as to communicate the results of the study. So, a good clinical research protocol should cover all these aspects to ensure that the ethical requirements for research on human subjects are met. So, I would like to mention that there are also ethical requirements for research on animals, and these are known as the 3R, which refer to the fact that you should try to use as few to reduce and to use as few animals as possible. That also the experiment techniques should be as refined as possible in order to avoid uh, causing any unnecessary pain or stress to refine. And if it's possible to replace the use of animal for example, some in silico or in vitro studies. For example, the use of cell lines where possible, or better, the use of computer models for biological simulation. And this is what we know nowadays as in silicon experiment.